So how do you write this into a paper? So overall, I think be short and sweet in your writing. There's no benefit in being lengthy and going into thousands and thousands of words. Read examples of the same article type that you're trying to do, particularly in high-impact medical journals or whatever you're aiming for, to be familiar with it. And then in your first introduction, this is the overall structure that I use. So first, I start with a couple of sentences about the topic as a broad whole and overall the prevalence of how common it is. Then I briefly, in 1 to 2 sentences, talk about evolution and advances in the field. Then I suggest the current area of improvement and I frame it. And then I suggest the aim of the study and list it clearly. Then in the methods section, this is my order that I follow. I list off the study design, the guidelines that we're following. You can find this on the Equator Network or website that lists out all the guidelines that you can follow. What the population is, the interventions and comparators, outcome measures, analysis that you were doing, ethics and institutional approvals as well. Then in the results, this is the easiest section to write up. You write about the population characteristics or like the demographics, and then list all the results per the outcome or measure that you were talking about. Then in the discussion, this is the structure I use. You summarize the broad implications, you compare to past evidence, you talk about the clinical implications and then the limitations, and then finally you end with conclusions of the topic, a very brief summary, and then the future directions going forward as well. And overall, when writing papers and when publishing, let your work do the talking. And I think the best way is form your own research profiles once you've actually got something on your record, and then people can look you up and actually network with you as well.